Hi friends. Today we are going to see the topic which has been most tested in NCLEX is delegation, which has been playing very important role, and many questions are being directed to assess the skill in the registered nurses regarding the delegation. So here we have to remember that always the registered nurse is accountable for delegating any type of task. There are five rates of delegation which has to be seen. These are the right task. So the appropriate right task has to be delegated this to a particular person who is responsible, and the right circumstances is the next right, where the patient is which patient is stable. These type of patients can be delegated. And the next is the right person whom the registered nurse has to select, so to whom the delegation can be assigned so that he or she can carry out the task. And next one is the right direction, or the appropriate type of communication has to be conveyed to the person whom we are delegating. So a clear instruction has to be given appropriately, so as the person who is carrying out the task can be performing it to the patients. Next one is right supervision has to be done, and an evaluation has to be carried out by the NRN, so as to see whether the appropriate task has been achieved, and the follow-up care has to be assessed, so as the patient's outcome can be checked. Next one, here we are seeing anything which is missing in the question, we have to see. We should not delegate which any of the among rights has been missing, so it has not be delegated to the person. So who can delegate? As I've already said, the registered nurse can delegate any type of task. She is the only responsible person to delegate the task to an appropriate person. So which are the things we should not delegate? These are the tasks which are related to assessment. Any assessment of the patient. It might be an initial assessment as soon as a patient is getting admitted. It might be a stable patient or an unstable patient. So the initial assessment has to be always carried out by the registered nurses. And the ongoing assessment has also to be carried out by the by the registered nurses, so as to check whether the condition has recovered or it is in the same status. So the next task which is done by the registered nurse is she is doing the nursing diagnosis. So the particular nursing diagnosis is being also carried out by the registered nurses, and she, according to the nursing diagnosis, she will plan for the care what has to be given to the patient to achieve the goal. And she, during this process, she always inculcate a teaching task, so as to teach the patient particular things. For example, it might be a diabetic patient where we are teaching the patient regarding the diet, or we might be teaching about the diet control, or the other habits like style changing habits like exercise. And we have to teach them how it can be inculcated in the daily life, day-to-day life, uh, to keep the insulin sugar control. Everything has to be carried out by the registered nurse. And the next thing is the evaluation. So whatever care she has given, whatever nursing care plan she has implemented, she has to have a check by evaluating whether it has been achieved, or she has to evaluate and she can re-implement what are the tasks which are not been attained by the patients. And she is the one who is responsible for assessing the unstable patients, because she has to assess, and she is very much knowledgeable. So she has to see which are the patients who are just above away from the normal. So these type of patients has to be assessed very fast and quickly, and any emergency situation has to be intimated to the physician at the earliest. Next one is the clinical judgment. Any type of clinical judgment which involves the registered nurse to implement the particular action. So she is the one who is always responsible for taking the clinical judgment. So a short form is that ADPI, which is also called as assessment, diagnosis, implementation, planning and evaluation. Okay. Next one is we have to always think and remember the thumb rule. Anything which is involving the judgment, the teaching or the evaluation process always stays under the scope of practice with the registered nurse. Next, we are coming to the other tasks which are carried out by the LPN, that is the licensed practical nurse. Here, he or she is responsible for the routine care of the stable patients. She is responsible for the oral medications. Here, it varies in many state to state or provinces. So, as such, NCLEX allows oral medications can be carried out by the LPN, licensed practical nurse. And she can do a reinforced teaching which is already carried out by a registered nurse, or she can do the wound care which is a continued wound care, not the initial one, and she can do the catheterization which has been taught to her, and she can be do a continued tube feeding when the patient is already getting. So these are the tasks which can be carried out by the licensed practical nurse. Next one is which are the things where she cannot carry out. The initial and the first assessment, whenever the patient is coming at the time of admission, or she is not allowed to do, and it is not under scope of practice. It is always under scope of practice of a registered nurse. And the care plans, again, she is not allowed to do the care plans. It is always under the scope of registered nurse. And the patient education, as I said earlier, she is allowed to reinforce the teaching, not the initial teaching she can do by herself. Next, we are coming to the unlicensed personnel, assistive personnel. Here, these type of persons are mainly focused on ADLs, that is activities of daily living. They help the patient with activities of daily living like bathing, feeding or toileting, ambulation, who are very stable type of patients. Here, these patients whom they are assigned are almost of stable type, and they are allowed to do vital signs, and they can assess, they can help them in ambulation. They can do intake output charting, and they can also do the bed making, which all comes under the scope of unlicensed assistive personnel. Next, which are the things which again is not under the scope of UAP is, she cannot do the assessment, or he or she cannot do the teaching, she cannot do he or she cannot do the medication parts, and she or she cannot interpret any type of data. She can implement it when it has been delegated by a registered nurse. Here the common rule is NCLEX delegation rules. Delegate tasks that are not involves the active thinking. We have to delegate the task which is always to an educated personnel who is very competent to carry out such type of task. So here we should never delegate the first time assessment, as I said earlier, and any type of patient teaching, unstable patients who are very sick, abnormal findings which requires judgment by an practice registered nurse. And here we are going to see an example here which patient the RN should see first instead of delegating. The one patient who is unstable, the RN registered nurse should see for any abnormal findings, and she should do a quick assessment instead of delegating such type of patients to practical RPN or the UAP. So these type of patients comes under the scope of registered nurse. Okay, thank you.